All right. I see we are live. All right. Good evening, everyone, and thank you so much for joining us for this important conversation. I'm Delegate LeVere Bolling, representing House District 80, which is a portion of Eastern and Western Henrico County, and I'm grateful to have you with us for tonight's webinar, Healthcare in 2026: How Medicare and Medicaid Changes Affect You. As many of you know, 2026 will bring several significant changes to both Medicare and Medicaid and the subsidy programs. These programs are lifelines for thousands of Virginians, older adults, people with disabilities, families, caregivers, and healthcare providers included. My goal tonight is simple: to make sure you feel informed, prepared, and empowered as these changes roll out. Whether you're tuning in as a beneficiary, a caregiver, or a healthcare professional, or someone who simply wants to stay engaged and advocate for your community, you're in the right place. So, we're going to break down what's changing, why it matters, and how you can navigate these updates with confidence. Now, I'm going to bring on our presenters for tonight, let them tell you a little bit about themselves before we dive in to tonight's information. We have with us Heidi Dix and Craig Connors. Hi, Heidi. Hi, Craig. Please, you all give us a little information about yourselves.
Hello, good evening, everybody. It's nice to see folks. My name is Heidi Dix. I work at the Virginia Association of Health Plans. I've been working in healthcare in Virginia for about 20 years. I'm really passionate about healthcare. I have a lot of experience working in the developmental disability and the behavioral health arena, but I also am now working for the health plans in Virginia.
Hi, good evening, everyone. I'm Craig Connors. I'm with the Virginia Hospital and Healthcare Association. Like Heidi, I've worked in Virginia healthcare for well over 20 years and in lots of different places, including health systems, long-term care, programs of all-inclusive care for the elderly, and I worked with a health plan early on in my career as well. And so now I'm, again, here at the association, and we represent all of the hospitals and health systems in Virginia. So it's good to be here. Thank you, Delegate Bolling, for having us.
Yes, thank you both for joining us. I'm so glad to have you here. So everyone who's watching live, please make sure that you're sharing the stream with your friends and family who might be informed, who want to be informed, because we're about to get into it. So let me tell you how tonight will work. First, we'll walk through some major changes coming in 2026, right? We're talking about the expiring subsidies and the Medicaid changes that are on the horizon. Then we'll discuss Medicare and the key differences between Medicare and Medicaid, along with some other key basics that will be helpful for you as consumers of healthcare. And then after that, we'll open the floor for your questions. Remember, this is meant to be an accessible and practical conversation. So please do not hesitate to ask what's on your mind in the chat or the comments. Myself, and shout out to my Chief of Staff, Morgan, we'll be monitoring them as we go along. And during the Q&A portion, we'll come back to those and get those answered for you. So thank you again for being here, and let's dive in. I'm going to pass it over to our first presenter, Heidi.
Thank you. I really appreciate it. And please ask questions. We were talking before the call about how confusing the healthcare space can be, even for people who, work in it every day. So we certainly expect questions, and that's great. We usually learn a lot from that. So again, I work for the Association of Health Plans. There are 8 major health plans in Virginia, and we work with all of them. So Anthem, Aetna, or CVS, CareFirst, Cigna, Humana, Kaiser, United Healthcare, and Centera Health Plans. I made sure I went through my list. So, if you have one of those healthcare providers, I work with those plans every day. We're happy to answer your questions. If you have a specific question about your plan, please reach out to Morgan, and I am happy to follow up and get you answers as needed. So the first thing I wanted to talk to folks about today is the One Big Beautiful Bill that passed in July. Some people call it HR 1. It's the same thing. It passed on July 4th or was signed on July 4th by President Trump. They made some very significant changes in the healthcare space across the board. The first area I want to talk to you about tonight is the Affordable Care Act. It was launched in 2010. In 2014, we began to set up marketplaces where people who needed individual insurance or they had a small plan could buy insurance. In Virginia, it's now today called the Virginia Health Benefit Exchange or the Virginia Insurance Marketplace. So many people, we're in open enrollment now, will select a plan and get coverage starting January 1 using the marketplace. And, when they first put the Affordable Care Act together, they wanted these plans to be affordable. There was a lot of regulation about them. And then there were tax credits provided to folks. So on the front end, their premiums that they paid every month, that's what a healthcare premium is, would be lower. And a lot of people took up that option. And then during the pandemic, Congress wanted to make sure people had access to care. So in 2021, they passed an enhanced tax credit. So for many people between, and I'm going to throw around some numbers, but 138% of the poverty level, which is less than $20,000 a year, up to about 250%, those folks essentially had zero or low dollar premiums. It was a low percent of their income. So people were able to access care. And there was a huge increase in people enrolling in insurance. A lot more people had access to it, and it was much more affordable. The One Big Beautiful Bill, or HR 1, there was an opportunity to renew those tax credits because they expired at the end of this year. And unfortunately, Congress has not been able to act on that. And so those tax credits will expire on December 31st. And all the health plans on the marketplace, if you are eligible for a tax credit, it'll be a much smaller amount. The impact for you day to day is that for many people, on average, and there's many complexities, is that premiums will probably double for many people. So some examples of that, or if you're making about $20,000 a year and you were paying $0 per month for your health insurance premium, you'll now have to pay about $794. This is an example. If you're making around $50,000 or $60,000 annually, you were probably paying around $4,000 a month, and now you'll be paying $1,500 more on top of that. So these changes are significant. Affordability is a huge issue for people, and health plans, we're definitely very concerned about people being able to access their coverage because Congress has not taken action. There are some things that the policymakers in Virginia, so members of the General Assembly will be considering these starting in January, and the new gubernatorial administration will also be looking at these. There are some things that can be done to perhaps help make this less difficult for folks in Virginia. So they could consider maybe doing some subsidies to fill the gap where those tax credits used to be, so people's premiums would not be as expensive. We also have a program in Virginia called reinsurance. It's not a consumer program. It's how the state helps health plans pay for very expensive folks. And that program could be modified in some ways to help with costs overall. But the General Assembly will have to take some action. And obviously coverage starts January 1st, and the General Assembly won't get done with their work until March and April. So there are some things we're going to have to work out together as policymakers in Virginia around the subsidies. So it's not great news, but I think just having people be aware that this is happening is really important. Reaching out for help to see if you can find maybe a different plan that is affordable is really important. I'll make sure to get Morgan some information, resources you can lean on to get more information, helping you sort through the options if that's something you're interested in. The second area where there are a significant number of changes, and I know Craig is also going to touch on this because his organization has, they have concerns as well as some of the changes that are coming up with the Medicaid program. There's some very significant changes. On the positive end, we have a microsecond of time to try to address some of these. So I'm going to walk through some of them. I imagine people will have some questions. I'm only going to really talk about two major things that are coming up in the next year today. There are several other things. If people have questions about them, I'm happy to ask, but these are ones that will have the most outside impact on our Virginians who are enrolled in Medicaid. So just for reference, we have about 1.8 million people in the Commonwealth that are enrolled in the Medicaid program. 90% of those people get it through a health plan. So they may not know they have Medicaid. They just may know that they have Anthem, Health Keepers, or that they have Humana, or Aetna Better Health. But those folks are enrolled in Medicaid. We've made great strides since we implemented something called the Medicaid expansion in 2018. And that allowed parent adults and adults between the ages of 19 and 64 to get access to coverage that they weren't able to get before. And that was a big deal for Virginia. And we saw a lot of people taking up coverage, which is great. We always want people to be insured. So two of the big changes that I'm going to talk about is first, I know people have been hearing about the work requirements in the program. It's also called, the official term is community engagement. And so what is key to remember here is community engagement includes working at least 80 hours per month. It includes community volunteer, community service, education, and other types of training that are still sort of being defined. But what I want to make really clear to folks that this is going to be implemented January of 2027. So that's when we'll see this take effect. We have a year. And I want to show folks, the Medicaid director shared this the other day. And I think it's just an important visual of how the work requirements affect folks who have Medicaid and how it doesn't, because it does not impact everybody. So I'm going to try to share my screen here. Can someone, I can't see anybody because I'm sharing my screen. So I don't know if you can see it. But this, again, this is a slide from Medicaid. So if you look on, it's my left, the base population, it's our traditional population that we have always covered since the 70s in Virginia. So children, adults, some older adults, some people who are caretakers, individuals with disabilities, and pregnant women. So those groups, and then the next group, the green group, the famous and CHIP folks, and a couple of 200,000 with limited benefits, children, pregnant women. So those individuals, the work requirements do not apply to that group, those groups of people. If you have a disability, if you're a caretaker for someone who's on a waiver, you're pregnant, or you're taking care of your children, you are not in the bucket where work requirements will be enacted. So I want to stress that to people. It's just really important to understand that it's not everybody. It's the orange group, so parent adults and adults who have joined as part of what I refer to as expansion that are impacted by these requirements. I've stopped sharing. So it's really important to keep that in mind when you're thinking about this. And there is a lot that still has to be determined by the federal regulator, the Center for Medicare and Medicaid Services, that tells states how to set up these programs. And so our Medicaid agency is awaiting guidance about how to set it up. So you will have some people that will be exempted under something called medical fragility. That is yet to be defined and approved in Virginia. So the state will define it and then propose it to the federal government, and they have to approve it. So all of these moving parts are happening right now. And it can feel very, for the Medicaid agency, they're worried. It's only a year away. And as you can imagine, trying to figure out someone who works 2 part-time jobs. What if someone's going to school, but during the summer they work a part-time job? What about someone who drives Uber and then is a caretaker? How do we count work requirements for individuals in those type of situations, which the reality is many people juggle all of these things at once. That is going to be very difficult, and it's going to require an investment in technology. And so, in the government, I've worked in state government for many, many years before I came to this role. I used to joke the information technology systems that help us do things and talk to each other. They're like an old car. Like I have an old car and I will drive it until literally the doors fall off and I cannot replace it anymore. Well past its useful life. And that's how we treat technology systems in government, because they're so expensive and so difficult to integrate. And so some of the major concerns are making sure we set up consumer-friendly systems so people can say, yes, I'm working, or yes, I'm taking care of my child who's 12 years old, or whatever it may be, so that they continue to be eligible for Medicaid. So that's sort of driving a lot of the questions right now. But once we have that figured out in Virginia, the health plans will be sharing, the hospitals will be sharing, the legislators will be sharing, the governor, the Medicaid agency, everyone will be doing their best to make sure people know how they can continue to stay eligible. And right now, we just don't have the answers to that. But again, the good news is we have a year, which isn't very long, but it's some time to be able to figure some of those pieces out so people know how they can stay enrolled. The best thing you can do right now, Medicaid, the Medicaid agency, it's called DMAS, has an app. It's called the Cardinal Care app. If you are a Cardinal Care enrollee, so you're in one of those health plans I mentioned, if you download that app, they put out a lot of information on that. You can also go on their website and sign up for their emails. So if you have a loved one that, receives Medicaid, you want to stay informed, that's a great way to do it. They also have Instagram and Facebook accounts where they publish a lot of information. So it's a really good place to kind of keep up with what's going on. They're very friendly to everybody. It's easy to understand, and they tell you what you need to do. So that would be my suggestion, just to kind of monitor that way. The other change that's coming up is around the same time. So December 31st, 26. I may have switched my dates, but they're right within a day of each other. 2 times a year, there will have to be a Medicaid eligibility verification. So right now in Virginia, and again, it's only for that expansion population, the orange group that I was talking about. Everyone else will continue to have their current rules, which are usually just once per year. For that other group of people, they will have to verify that they're working or otherwise in community engaged, and that they continue to be financially eligible twice per year. That's happening around the same time. It's also going to be a huge investment in technology. So those things are happening at once. We have a year, but again, the best thing you can do is to stay informed, so you know where to go to verify those things. If you have someone who gets Medicaid and you want to be a resource to them, that's a great way to do it. Morgan just put up the website for Virginia. If you go, there's a patient or member page. They have a lot of great information there. So those are sort of the highlights. There are many other changes that are happening in Medicaid and elsewhere. It's a huge bill, but those are the things that we're spending a lot of time with right now and talking to our legislators about, because I know they want to make sure, like Delegate Bolling does, that people retain their coverage wherever they can. So with that, I'm going to, if you want to turn it over to Craig, or however you want to run the meeting.
Yes. I have a child that just woke up. So I want to thank you, Heidi, so much for giving us that rundown. And again, to the audience that's watching, thank you for staying with us as we walk through these updates. I know it is a lot of information, but understanding these changes now will help make navigating 2026 much easier for all of us and 2027 as we get there. And so at this point, we're going to shift into the next portion of the discussion where we've covered the major changes with Heidi, and now we'll take a closer look at Medicaid and Medicare differences alongside some other healthcare information. And again, I want to remind that after we go through this next section, we'll open the floor for your questions. So as you're listening, feel free to jot down anything that stands out or anything you'd like clarification on. Your questions really help make these conversations more useful for everyone, and especially for me as we go into General Assembly and have to make some decisions on some laws here and some funding. So with that, let's move forward to our second presenter, Craig Connors, and talk about what these changes could look like for you and your family. To you, Craig.
All right. Thank you. Before I get into some of the differences between Medicare and Medicaid you might be interested in, I think it's helpful to look at the broad context of where people in Virginia get their health care coverage from, their financial health care coverage from. And so, I would imagine that there are people watching now who fall into all of these buckets. So, at a high level, generally, over half of people in Virginia receive their health insurance through their employer-based coverage. And that you might be a state or a local employee. That's considered employer-based coverage because you're on the state employee health plan. Or you work for a private company and you get your health insurance, or you and your family get your health insurance through your company. That's employer-sponsored insurance, and there's multiple different health plans out there. Heidi gave you a list, and most of those health plans offer employer-sponsored insurance as well as Medicaid and Medicare. And so again, slightly more than half of people in Virginia get their health insurance that way. As you know, there are many military members and families in Virginia. About 5% of Virginians actually get their health care through the Department of Defense, through the military. And if you've ever heard of TRICARE, if you have TRICARE is a privately administered program for military families and retired military. So again, that's about 5%. So we're up to about 55%. Additional 5 or 6% currently of people get their health insurance through Virginia's insurance marketplace. And Heidi mentioned the marketplace. It's otherwise known as, you'll hear ACA plans. You'll hear the marketplace called exchanges, because in other states, including at the federal level, it's called the Health Insurance Exchange. But in Virginia, like Heidi said, it's called the Health Benefit. It's called the Virginia's Insurance Marketplace. And that's when you go to the marketplace, and you can either just Google or go to virginiasinsurancemarketplace.com. Open enrollment is occurring right now, and you can enroll yourself for individual coverage on the marketplace. And all of these tax credits and enhanced premium tax credits and the changes coming through HR 1 that Heidi talked about, those are mostly directed at the marketplace. And so again, we can answer more detailed questions, but about 6% of Virginians get their health insurance through the marketplace. As you can see, a lot more people get their insurance through their employer than they do through the marketplace. Now let's move on to uninsured. Unfortunately, while the uninsured rate has reduced significantly since the passage of the Affordable Care Act 13 years ago, still about 6 or 7%, depending when you're looking at it, of Virginians don't have any health insurance. And so those are uninsured. Those are people who typically, you may know some, you may be one. You go to the doctor or the hospital, and you are what they call self-pay. You have to pay out of your pocket. And so a goal in all of this, when you hear the politicians debate left and right and what they think is a good idea and what they think is a bad idea, et cetera, I think everyone is on the same page that we want as many people as possible in this country to have some kind of health insurance, health coverage. So when we're talking about letting tax credits expire, or when we're talking about stricter Medicaid eligibility rules, what we're really getting at is anything that is going to restrict people from access to healthcare finance is generally not a good thing. We want to bring that uninsured number down. Okay, so if you're following my numbers, that leaves us with two more buckets, Medicare and Medicaid. So about 15% of Virginians get their coverage through Medicare, and about 19 or 20%, you saw the number from Heidi, about 1.8 million Virginians get it through Medicaid. So Medicare and Medicaid, add them up, you're at about 35%. About a third of Virginians get their health care through one of the programs. So the difference is Medicare is what they call an entitlement program. Okay, so what an entitlement program is if you meet certain criteria, you are entitled to it, regardless of your income, regardless of any other circumstances. So generally, Medicare, if you or your spouse has worked for 40 quarters, is the way the law is written, or 10 years, over the entire course of your life, once you reach age 65, you are entitled to Medicare. And the reason you're entitled to Medicare is because during those 40 quarters of work, you paid a Medicare payroll tax. So anyone who's looked at their pay stub really closely, you're going to see something's being taken out, right? 3.8%, don't quote me on that, but 3.8% or so of your paycheck is being taken out for a Medicare tax. Well, what you're doing is you're paying into the system. So once you reach age 65, you qualify for Medicare, and it's an entitlement. You get it, regardless of your income. As a quick caveat, just if anyone is very familiar with Medicare, there are a few subgroups of people who can qualify for Medicare and be younger than 65. And specifically, there are certain disabilities that can be qualifying for Medicare, and everyone who has end-stage renal disease or kidney disease that you need dialysis. Medicare covers that, regardless of your age. Okay, but just in general, that's it. I'm going to come back to Medicare in a minute, but let's go to Medicaid. Heidi talked about Medicaid, and I encourage everyone to look at the DMAS website if you haven't. And thank you also, Morgan, and Delegate for putting the marketplace link in the chat. Medicaid is an income-tested program. And so regardless of your physical status, or how long you've been working, or whether you work now even, you qualify for Medicaid by meeting certain financial criteria. It's not an easy formula because if you recall the slide that Heidi showed, there's all these different categories of Medicaid. And you, based on the different category, there's generally a different income or asset qualification for that category. For example, Medicaid pays for most long-term care in the nation, and Virginia is no exception. Long-term care being if you have to receive assistance in your home, or if you have to live in a nursing facility, that's long-term care. If you have trouble with doing activities of daily living. Most Americans in long-term care, actually Medicaid covers that. But in order to qualify for it, there are much more stringent income and asset qualifications to qualify for long-term care through Medicaid than there are through, say, a working adult who's part of that expansion population. So again, Heidi and I both can answer more detailed questions on different income criteria, but just realize Medicaid, you have to be at some income qualification criteria to be in it. There is another complication. This is all complicated stuff, right? There's another complication that you may know someone, or you may be in this category by yourself. Some people, because of their age and their income, do qualify for Medicare and Medicaid. They qualify for both of them. And the reason they can qualify for both of them is, again, they meet the criteria for each. And so when they qualify for both of them, typically Medicare picks up any bills first, and then Medicaid would cover anything that Medicare doesn't cover. Okay. All right. Hopefully you're following. Let's go back to Medicare then. Let's just talk straightforward Medicare. You've paid in, you qualify for Medicare as an entitlement, you turn 65. What happens? You are contacted by Medicare, and you have what's called an initial enrollment period. And I'm guessing at least some people watching this have either gone through this yourself or you've had a family member or a friend who's gone through this. And during the initial enrollment period, you have 7 months to select how you're going to receive your Medicare. You have 7 months to enroll in what's called Part B. And so I'm going to come back to the parts of Medicare in a minute. And then after you enroll in Part B, you have 6 months to decide if you want what's called a Medigap or a supplemental coverage plan. You also have a choice on whether you're going to join a Medicare Advantage plan. So let's come back to all those terms. Medicare is split into what they call parts. Okay, so Part A Medicare covers hospital care, home health care, skilled nursing facility care. Then there's a Medicare Part B. Medicare Part B covers physician services, outpatient services. So think of going to your doctor's office and getting an ultrasound. That's Part B coverage. Part C is what's called Medicare Advantage, and hold that thought, I'm going to come back. And then Part D is drug coverage. So when you first join Medicare, you have Part A, you're entitled to it. You have Part B, which you need to select it. You actually have to pay a premium for Part B coverage. And the vast majority of people who join Medicare also join Part B. Part B coverage, the premium for it changes every year, and the government sets that premium. It's not a health plan or anything like that. The government sets the premium for what's called original Medicare Part B coverage. That premium can be taken out of your Social Security check, and most people who select Part B also are receiving Social Security benefits, and they can choose to get the Part B premium taken out of their Social Security check. So it's kind of transparent. And then Part D, you have to select a Part D drug plan, and those are offered by private insurance companies. So most time people get set up, it's called original Medicare. They've got their Part A, they've got their Part B, and they select a Part D plan. Those plans all have what are somewhat significant cost-sharing responsibilities. So if you access healthcare using your Medicare, Medicare covers it. You can see any doctor or hospital that accepts Medicare, which is the vast majority in this country. But you have what's called a co-insurance responsibility. You pay a portion of it, and it's generally 20%. You pay out of pocket yourself. So what happens, and what most people end up doing, and you have to do this within 6 months of enrolling in Medicare Part B, is the way the rule is written, is you can purchase a Medigap or a supplemental policy, Medicare supplement policy. There are many companies in Virginia that offer those policies. I can certainly direct I can direct you to a website where you can find what policies those are. Medicare.gov also has a website that says what Medicare supplement policies are available. But most people will enroll in a Medicare supplement policy and pay a monthly premium. Paying that monthly premium, what happens is that supplement policy covers part or all of your cost sharing responsibility, depending on what type of Medicare supplement policy you enroll in. It's a good idea, if you can, to enroll in a Medicare supplement policy when you first join Medicare, because within that 6-month window I've mentioned a couple of times, there's what's called guaranteed issue. And so that means a Medicare supplement plan has to offer their plans at the same premium to everyone, regardless of what that person's health status is, if you enroll within that 6-month period. If you decide to enroll in a Medicare supplement plan later, after that 6-month period, then the companies are generally allowed to do what's called individual underwriting and charge you a premium based on your own health status. So it is a good idea if you're just joining Medicare to look into Medicare supplement. Okay, everything I just talked about is what's called original Medicare or traditional Medicare. That's where you get a Medicare card. You can go to any physician or healthcare provider that accepts original Medicare. There's an alternative to original Medicare, which you've probably heard about also, or at least you've seen commercials or received phone calls from some of the companies that offer these, and that's called Medicare Advantage. So Medicare Advantage is in the law as Medicare Part C. So it is very confusing. So you've got A, B, C, and D. But when you join Original Medicare, you're in A, B, and D. But Part C is this carve-out alternative called Medicare Advantage. So Medicare Part C or Medicare Advantage is Medicare benefits. And so all the benefits you get under Original Medicare, but they're offered through private health insurance companies. And so the biggest Medicare Advantage plans in Virginia by membership are offered by Humana, United Healthcare, Anthem, and Aetna. And so you may have seen these companies promoting, get your Medicare coverage through us. And so when someone's in Medicare, they have a choice to make. Do you want to stay in Original Medicare, or do you want to do Medicare Advantage? And it's either or, it's not both. It's one or the other. You get your Medicare benefits through Original Medicare or through Medicare Advantage. There are pros and cons to both sides. I think one of the pros to Medicare is the wide access, to Original Medicare is the wide access to physicians and facilities. One of the cons is that cost share responsibility that I just mentioned, that most people will choose a supplement plan to help cover. Some of the pros of a Medicare Advantage plan is Medicare Advantage plans have the authority under the law to offer some additional benefits that Medicare, Original Medicare, can't offer. And so oftentimes you'll see hearing aids, vision, dental, gym memberships, food assistance. And all of the plans offer different additional benefits. So don't assume that one company offers the same additional benefits as another one. But they generally all offer some additional benefits that you couldn't get through Original Medicare. So that's definitely a pro of Medicare Advantage, and something that a lot of people consider when they're choosing to enroll in Medicare Advantage for. One of the potential cons of Medicare Advantage, it's not always, it depends on the Medicare Advantage plan, is what's called the network, right? The provider network. Usually when you enroll in a Medicare Advantage plan, you are agreeing to use the in-network providers that Medicare Advantage plan is contracted with. Now, this is something that we always advise people to look very closely at. If you are going to enroll, or if you're thinking about enrolling in Medicare Advantage, you definitely want to find out which providers would be in-network and out-of-network, and consult with that plan and review their materials to see that. So either way, there are pros and cons to Medicare and to Medicare Advantage. And there are some resources I'll switch over to in a second. I do see the question in the comments, and I'm happy to talk about the birthday rule. And I'll do that in just a second. I'll come back to that question. But let me share with you, if you are enrolled in Medicare, enrolling in Medicare, or have a family member who has questions, the Hospital and Healthcare Association, we've created we're trying to make it like a one-stop shop, if you will, for some Medicare information. And so I'm going to just show that very quickly, and then we'll come back for questions. So if everyone can see this, and I'll post, you can see the URL there, but it's basically just vhha.com, and I'm just going to stick that in the chat here. If you come over to this menu, go to Healthcare Finance, and we have information on Medicaid as well, Medicare Advantage, Managed Care. But anyway, Medicare and Medicare Advantage, and we've created a short list of resources, educational resources, some general knowledge resources, and comparing Medicare Advantage plans, comparing Medicare supplemental insurance policies, and then some Virginia specific resources. So one really, here's one nice resource. This is from CMS. It's a fact sheet on the difference between Original Medicare and Medicare Advantage. We have an educational resource, which is basically the same information, just distilled down. So I'm not going to go through all of these, obviously. I at least wanted to make all of the viewers aware of this. There is a resource here on the birthday rule. And so you can come read more about it. But essentially, what the birthday rule is in Virginia, it means that on the month of your birthday, if you're already enrolled in a Medigap or a Medicare supplement policy, and you want to switch policies, you are able to switch policies and be not denied for coverage and not charged a higher rate than you currently are charged in your current policy. So there's a key thing with the birthday. It's a great law, and the General Assembly really applaud them. It just became effective this July, just passed in 2025, and so it's a great consumer protection. There's one thing about the birthday law, and I can stop sharing now. There it is. There is one thing about the birthday rule that people do need to understand, though, and it is if you never enrolled in Medicare supplemental, a Medicare supplement plan during that 6-month window that I've already mentioned a few times, and say you enroll in a Medicare Advantage plan, if you choose to leave a Medicare Advantage plan and then want to enroll in a Medicare supplement policy, the birthday rule doesn't apply to you because you never enrolled in one to begin with. The birthday rule is really just lets you switch your Medicare supplement policy if you've been in a plan. So I'm sure if you're following, one question you have is, well, should I get a Medicare supplement plan and be in Medicare Advantage? And the answer is no. Those two things are also mutually exclusive. Medicare supplement goes with original Medicare. Medicare Advantage is, in a sense, a supplement policy. Medicare Advantage plans typically charge premiums that are much less than you would have to, pay out of pocket if you were in original Medicare. Sometimes there's $0 premiums. Medicare Advantage plans, you can get them with or without drug coverage. Most Medicare Advantage plans are what's called MAPD. They have drug coverage. And Medicare Advantage plans cover a lot of the cost sharing for you, although there are still cost shares that you need to look at, but they cover a lot of the cost sharing that a supplemental plan would cover. The big challenge with Medicare Advantage when it comes to supplement plans, and this is something that everyone should think through carefully. If you join Medicare Advantage and never enrolled in your supplement plan, when you leave Medicare Advantage, you don't have that protection that the birthday rule provides. And so therefore, you could potentially be subject to a higher rate Medicare supplement plan if you want to come out of Medicare Advantage and go back to original Medicare with the supplement plan. And you're able to do that. Twice a year for people who are in Medicare, there are different what's called open enrollment or annual enrollment periods. Every year from October 15th until December 7th, there's what's called the annual enrollment period. And that's where anyone on Medicare can choose a Medicare Advantage plan. If they're in Medicare Advantage, they can leave Medicare Advantage and go back to original Medicare. Then every January 1st through March 31st each year, it's what's called Medicare Advantage open enrollment. And so that's another period. That's for people who are already on Medicare Advantage. You can switch plans or you can disenroll from Medicare Advantage during that period. The one thing you can't do during the January 1st to March 31st Medicare Advantage open enrollment period is be in original Medicare and then enroll in Medicare Advantage. You have to do that during the October 15th to December 7th period. All right, that was a lot, I'm sure. At this point, I'm watching the clock. We have about 15 minutes left, and I think that's about the end of my prepared remarks, if you will. We, I think, have 15 minutes left, right, Delegate Bolling, where we can do Q&A and answer questions, or if there's anything that's already been asked that hasn't been answered.
Yeah, absolutely. Well, first, let me thank you so much, Craig, for telling us all about this information. I mean, you broke down Medicare in a way in which I think the folks who are watching truly appreciate, and I appreciate because I know a lot of it just from walking through a lot of my elderly family members through the process, but you just explained it. So I'm going to make sure that they watch this if they haven't. And the folks here that are watching, please make sure you share this. It'll be posted on my YouTube page, also on the Facebook. You can share this around and help your friends and family be able to understand this information as well. I want to thank y'all for continuing to stick with us. We are at the question and answer portion. So we're going to go ahead and give you all the opportunity to ask any questions you may have about Medicare and Medicaid, the updates, whether it's about eligibility, coverage, costs, or how to prepare for the transitions and changes that were talked about earlier. If you haven't already, feel free to drop them in the comment section We may not be able to get to every question tonight, but we'll do our best and we'll make sure to follow up with additional resources after this webinar. So let's get started with some questions. There was one, you answered the birthday rule, Craig. So I saw another that said, if I have Medicare Part A and B and still have insurance through my job, through Aetna, I use my Aetna insurance as a supplement, correct?
Generally, the answer is yes, although I would urge you to just speak with your human resources department about that. There may be some restrictions depending on the type of employer plan you have, whether it's a self-insured plan or what we call a fully insured plan. So generally, yes, but do confirm with your company. I don't want to give any erroneous information that would not apply to your specific situation.
Absolutely, absolutely. So, Ms. Hudgens, please check with your HR, and if you come up with any questions after speaking with them, feel free to reach out to my office, and I can get you in touch with Craig, or we can walk through some options with additional resources. We have another question here that we might need some clarification on about how does the supplement work. Craig, you wanna, or Heidi, either one.
The Medicare supplement policy, say you purchase one and you have it. It depends on the supplement policy, right? It all depends, right? It's very confusing. The VHHA.com website, or you can just Google CMS or Medicare supplement policies. By law, there's 10 different types of Medicare supplement policies, and the companies that offer these policies have to conform to one of the 10 benefit types. The amount of coverage you have depends on which one of the 10 you decide to purchase. But the way it works in general is you go see, to your healthcare provider. The healthcare provider, bills Medicare. Medicare pays generally the 80%, and then your healthcare provider will bill your supplement plan for the rest. And depending on the coverage, your supplement plan just pays like a health insurance to the provider. If there's anything left over based on the supplement that you chose, then you'd pay that out of pocket. But it depends on which supplement you buy.
Yes, thank you for that answer as well. Ms. Williams, I hope that answered your question. We have another that asks, is Anthem leaving Virginia like in Maryland?
The answer to that is no. As of right now, no. I have not heard that from my colleagues at Anthem. They are a huge presence in Virginia. I don't see that happening anytime soon.
I can add on to Heidi's answer. When you look across all of those different types of insurance that I started with, about 45% of all Virginians have their coverage through Anthem, whether it's the employer, Medicaid, Medicare, Anthems, and all. I would be shocked. And actually, about half of Virginia would be very upset if Anthem left. So I definitely don't think so. Yeah.
Yes, I know a lot of people that would be very upset about that. Mr. Washington, I hope that was an answer for you. And then we have another here that says, I am a retiree who receives Medicare, and I also have my Virginia retirement. I think she meant Advantage 65. Should I anticipate an increase for Medicare? I think you meant under costs, maybe. I think of cost for Medicare.
Cost or calls?
Calls.
I think she maybe meant cost. I'm assuming. This is my mother-in-law. I'm just guessing for her.
So,
cost. She clarified cost.
So if you already receive Medicare, oh, you mean, and you're still working when you retire?
No, she is retired.
She is retired on Medicare.
And she also gets her, I guess through her Virginia retirement, also gets the Medicare Advantage 65. She's wondering if the cost for Medicare is going to increase.
So every year, the government increases the premium for Part B, but the government sets that. So that cost goes up every year. And you'll see that additional. What the government tries to do is they try to make, although the formulas are complicated, usually if it works well, the Social Security benefit goes up at or at a higher rate than your Part B premium goes up. So your money coming in is not going to go down, but your cost to pay for Medicare Part B does go up year over year. I didn't mention, I'll make a quick thing on Heidi. I talked about HR1. Another thing the government's done is, you may have heard about the price negotiation for drugs that Medicare has done. And starting next year, the first 10 drugs that Medicare negotiated prices for go into effect. That is going to have a big deal if you are in say, a Medicare Advantage plan or a Part D plan where you have a co-insurance, which is you basically pay a percentage of that drug. The government's estimated that for those 10 drugs, the cost of them is going down about 50%. So if you pay a co-insurance for those drugs, your out-of-pocket cost is going to go down about 50%. There's an additional thing that's happening in 2026 with Part D. Part D has always had what's called a donut hole, where your Part D plan covers a certain amount of money, and then in the middle, you have to pay out of pocket, and then it starts picking up later. That's going away in 2026. Congress passed a law which there's an out-of-pocket cap of $2,100, period, with no donut hole, period. You pay $2,100 max, depending on your benefit design, and that's it. And so that's going to save a lot of people a lot of money, especially if you take a lot of medications. So I think hopefully, Ms. Bolling, with a little bit of premium increase, but significantly lower drug costs, I actually think your out-of-pocket cost for Medicare, hopefully, generally, and this is probably not true for everyone, should go down going forward.
It's a good point, Craig. I can answer this next one about the changes to benefits.
Yes, that'd be great.
Sure. So I like to think about Medicare and Medicaid separately. So the short answer is there is nothing in any of the legislation that I talked about, the one big beautiful bill, that actually changes or tells a state they have to change the benefits in their Medicaid program, or that Medicare has to change its benefits. So in the short term, we should not see any changes. There should be really no changes in networks and who accepts Medicare and Medicaid. I think that 3 to 4 years, 5 years from now, there are some other things we didn't really get into today. There's more money coming out of the system. More federal money is being taken out of the system, especially for hospitals and states. There might have to be some changes at that time. However, that's 5 years from now. It's several elections from now. And so it's not something we've really leaned into yet. But certainly that is a concern down the road. I don't know if Craig wants to add to that.
No, I think you covered it. That's right. I think in the near term, like Heidi said, don't be concerned about, if you already have Medicare and Medicaid, the services covered are still going to be the same services covered. It's really some of the eligibility rules about Medicaid that Heidi talked about that we're worried about. But if you're in Medicaid, your coverage is going to be the same.
Yeah, I agree. Thank you all for that. And then we had another question pop in that says, is the donut hole closing the same thing as closing the gap?
I don't know. I mean, closing the gap, that could mean a few different things. If Mr. Washington maybe wants to clarify. I mean, I've heard the donut hole called the gap, but there's probably other things called the gap that might be applicable. If you're talking specifically about Medicare drug coverage, Medicare Part D drug coverage, probably so. That's probably what you're referring to. If it's some other issue with Medicare, maybe not. So I don't know. I guess that's the best answer I have, unless there's further clarification.
Yeah. We had another question about, what should caregivers, especially those with elderly parents, know about navigating any upcoming changes, or just in general, maybe about the two systems?
Want me to go first, Greg?
Sure, yes.
I don't want to assume, but I'm definitely in the sandwich generation, so I can appreciate this just from a brass tacks perspective. Again, initially, especially in Medicare, we're not likely to see a lot of significant changes. So that's, a good thing. For example, my parents wouldn't have to change providers or anything like that. I think staying informed is the biggest thing. And I know it's difficult because it's such complex information. There's sometimes too much information coming at you. Medicaid, I really do count on the Medicaid agency and Cardinal Care to sort of be the source of truth for folks in Virginia. And so that's a great place to get information, or they'll tell you where to get information. For Medicare, CMS, actually, I think Craig probably knows a little bit better, but I think they do a decent job of sharing information with consumers. And there's a lot of resources out there. So trying to link to some of those, there's even some locally in the Richmond area that you can connect with, can be really helpful, just to follow their socials and then, make the call if you have questions. And of course, I would be remiss if I didn't say, you can always call your health plan. They are there to help, or you can message them, and they should have information for you about what's happening with those changes and what you may or may not need to do.
Yeah. Craig, anything from you?
No, I mean, again, we said the benefits aren't changing. We've already talked about some of the financial aspects. If you're supporting an elderly parent who has Medicare and Medicaid, just again, beware the eligibility criteria for long-term services and supports for Medicaid is quite onerous. And just pay attention over the next year. Like Heidi said, in 2027, the eligibility is going to have to be re-verified every 6 months. So just pay attention, because you'll want to stay ahead of that. But I don't think we need immediate coverage.
Sorry, Craig.
No,
I just want to add, if you have a parent or a loved one who has Medicare and Medicaid, you should definitely call your health plan, because they are really incentivized to make sure people know what they need to do and where to get care and get all the information they need. Usually you even have a care manager. So that's definitely the right resource for that.
That's amazing. Well, we're coming upon our hour here in a couple minutes. So is there anyone out there that has a burning question that they'd like to throw in to be our last? And if not, I would like to again ask Heidi and Craig, are there any other resources or ones that you can mention again? Oh, there's Morgan putting it in there for me. Where folks can find more information should they need to.
The Virginia Poverty Law Center can be very helpful in referring people to resources, in my experience as well.
Yeah, I agree with Heidi. And you could go to Cover Virginia website as well, in addition to these that have been shared during the program tonight. I think between all of those, you should be in good hands. And I agree with Heidi that the health plans have some great resources too, if you just want to contact your health plan. And if you're looking to join a health plan, the marketplace, which again, the link is there, has some good information as well. The information's there. It's the hard thing is just trying to figure out which is the right to act. It's all out there. It's just the wayfinding is the hard part. So hopefully tonight's program's been a little bit of a help in that regard.
Awesome. Thank you both. Well, thank you all so much for joining tonight's conversation and for your thoughtful questions. It's clear how deeply our community cares about understanding these changes and making sure that every Virginian can continue to access the care they need and deserve. As we move forward and toward 2026 and 27, my commitment remains the same: to advocate for policies that strengthen healthcare access, protect our most vulnerable neighbors, and keep you all informed every step of the way. So if you did not get your question answered, or if something comes up to your mind later, please feel free to reach out to my office. We're here to help. And tonight's webinar, let me say, will be available for replay on Facebook and YouTube. And we'll also share additional resources to guide you through the upcoming changes to Medicare and Medicaid as we get them to the office. So I want to thank Heidi and Craig for staying late after work to join me to bring this great information to you all. And I want to thank the audience again for your time, your engagement, and your trust. I want everyone to please stay safe, stay informed, and I look forward to continuing these important conversations with you. I hope everyone has a wonderful evening and holiday season. Good night, y'all.
Thank you.